Today we're going to be talking about rare surgical procedures and ailments, specifically in focus of the Zinker's diverticulum. So, have you ever experienced a medical condition like this? It sounds science fiction, one of the ones that you'd find in ER with Dr. Green running around trying to figure it out. It is so rare that only 1% of people actually ever get it, and it's more common in women than it is in men. And in men, it is even rarer when they're over 50. Next slide. My husband, he experienced going through all of this, and he is what inspired this. So constantly, before he was diagnosed with it, we went from doctor to doctor trying to find out what was going on with him. And the symptoms were confusing, and they at first thought it would be GERD or something like that. And it was only one GI doctor who actually discovered, going through his old school books, what it was. It's always important to be able to know your body. That way you're better to understand what care you could get. It is often misunderstood as Zinker's diverticulum, and I hope that by sharing my husband's journey, going through it as his wife, all the way through it with surgery, recovery, and healing, I hope that this kind of pinpoints the importance of uncommon symptoms and illnesses and ailments that could happen. And hopefully the challenge, more understanding to the challenges whenever someone's trying to heal from such a rare ailment. So what is Zinker's diverticulum? It is where a pouch forms in the back of your throat. In my husband's case, it was about the same width of the esophagus, which is 7 millimeters. It normally disrupts, I'm not saying the word right, disrupts normal swallowing. The symptoms also include weight loss, throat discomfort, and difficulty in eating. It would also, when it first began, it just started with a small cough for him. And it progressed to the point where he was not able to keep food down. It was caused by the dysphagia, which is a difficulty in swallowing caused by the valve that shuts on and off and switches from your lungs to your throat. So the golden standard for the test, for diagnosing that, is the barium swallow test, which is where you ingest a dye while you are getting an x-ray. For him, he had a modified barium swallow, which took it at a thinner amount because it's normally very thick substance that they use the barium swallow with. Using that, it reveals the location and size of the pouch here. Can't quite make out the words on that one. So it only takes about 30 to 35, sometimes an hour, depending on your hospital. And this test, the barium swallow, it can help diagnose GERD and other swallowing disorders, which include other diverticulums non-specific to the Zinker. And yes, that is a nasty little side effect that can be uncomfortable for some who have GI tract problems. So, and I know most people will be going, ooh, at this point, because nobody wants to see the inside of another person unless you're in the medical field. So, this is where we get into the nitty-gritty of how to treat it. And it all depends on the type and severity, because some may just have a little walnut in the back of the throat versus a giant sac. So, with one of the most common ones, well, I can't say common, every procedure is different. So with some procedures, you open up the whole pouch and just let it through. And one such procedure is called a staple-assisted endoscopic. Word's not hitting me. I really should have had this one on the slide too. But it is where you literally have a staple come down in between, cut it, and have the walls held together with the staples, but causing the diverticulum to open up into the esophagus. For my husband, he had a diverticulotomy, which is where he got it removed entirely, but he had it endoscopically, which is is using the golden standard, the flexible endoscopic cricopharyngeal myotomy.
Use ANC for PNC. Use PNC. Use PNC.
This is essentially one thing that he had, where the seal that I told you about, the muscle, he took it, had it, and they basically cut it. They took that, and it is now part of testing at a cancer institute. So pre and post surgery, this is something that everyone is going to have a challenge with, including my husband. That was very hard and frustrating, and how many things have calories. So with that surgery, the surgery for the Zinker diverticulum, you have to make sure that you're able to be a healthy weight within a reasonable weight limit. Otherwise, they can't operate on you. So the biggest problem is that you can't get things past it, so it has to stay with a liquid-only diet. That's difficult, and you always have to have a daily calorie and protein intake, so you just count both of those, and that's two different books sometimes. That's why they recommend keeping a food diary, and as frustrating as a patient as it would be, it was mandatory. How many calories do you get? Some things that are high in it are honey, yogurt, and you can find a myriad of protein drinks from Equate to from the rice protein shakes. The healing process. The healing process really just requires a sterile environment, mainly so you don't get any infections. Unfortunately for my husband, one thing that was making his healing process longer was the fact of right after getting his staples pulled, he developed a severe infection and had to go straight back to the hospital, which was not fun and was immediate because right after his staples was pulled is when it hit his body. Due to that infection, they had to remove tissue and use a handy little medical device, which you'd never think would be so handy, a negative pressure wound therapy, where they literally seal an open wound with foam and give it a sterile environment until all the capillaries, everything that's important, closes up more. Then when it comes to the point where it can be removed, when there's less fluid drainage from it, it can be changed into a hand-packed wound like this one, so the body can normally close up. And that is one thing that, again, with sterile environment, you always have to make sure, always keeping up with changing your bandages and changing the packing and always keeping everything involved sterile. So to cover this, as rare it is as it is, knowing your body, being persistent, even if it's a rare ailment, your body, and if you keep an eye on the way your body is, you'll be able to know what would possibly be what's going on. Even if you're not medical, you know what that something is wrong, and that will lead you to get more care, which is advocacy for yourself as a patient or your advocacy for a family member. Along with this, most of mine is from Cancer Institute. Thank you.
Oh, man.